I ask all of our guests to please take their seat. The Subcommittee on Oversight and Investigations will now come to order. I now recognize myself for a 5-minute opening statement. Today's hearing is the first opportunity for Congress to hear testimony from Dr. Mandy Cohen since she was appointed the CDC, Centers for Disease Control and Prevention, Director in July. Dr. Cohen, congratulations on your appointment. You are taking the reins of the CDC at a critical time in the agency's history, and you have a heavy task ahead. As I said at our June oversight hearing, the COVID-19 pandemic revealed that we did not have the CDC we thought we had. I'm looking forward to hearing about how you plan to change that. This hearing is also an opportunity for us to hear firsthand about how the CDC is responding to the ongoing respiratory virus season. I'm particularly interested in hearing about how CDC is helping to mitigate the shortage of respiratory syncytial virus, or RSV, immunization for all infants. We have already heard reports that RSV cases are rising sharply in certain areas of the country and that some hospitals are in surge mode. With unprecedented demand for RSV immunizations this year leading to supply constraints, I hope we will hear what the CDC plans to do to ensure we have a sufficient supply of product for the seasons to come. It's great that we have a safe, effective RSV immunization to protect our children, but it does us little good if we don't do a better job at preventing supply constraints. Questions remain. How is the CDC planning to rebuild public trust in the agency? Has the CDC learned from the mistakes it made during the COVID-19 pandemic? Is the CDC committed to making the hard and deep reforms needed to avoid repeating those same mistakes? While I'm looking forward to hearing your testimony on these points, I candidly haven't seen much outward evidence yet that the CDC has taken the failings of the COVID-19 pandemic to heart. Another area I have grave concerns about is the detrimental effect extended school closures have had on our kids' learning. According to a report by the National Assessment of Education Progress, the average testing scores for U.S. 13-year-olds has hit the lowest level in decades. According to a New York Times report from earlier this month, school closures led to 50 million children, including my own, being out of the classroom, causing these students to miss an extremely crucial time in their lives since they were forced to attempt to learn from home. And let me assure you, learning from home for school-age children is not as effective as being in the classroom. In the same report, the Times claims this may prove to be the most damaging disruption in the history of American education. The damage wrought by school closures was enormous, and our children will be living with its consequences for decades. As I've said before, for better or worse, CDC recommendations and guidance carry great weight. They were used to justify not only school closures, but prohibiting nursing home visitations and vaccine mandates that would have resulted in millions of Americans losing their jobs. In addition, businesses, fitness centers, and worst of all, churches and other places of worship were closed. Further, the discovery of an illegal biolab in Reedley, California exposed more problems at CDC. CDC's management of the Federal Select Agent Program has been subject to criticism in the past for inadequate investigations in response to biosecurity incidents, including investigations from this very subcommittee. Reading the China Select Committee's report showed how inadequate CDC's approach to the Select Agent Program is. CDC initially refused to even investigate the lab and only did so once they were contacted by Democratic Representative Jim Costa of California. The CDC even refused to test any of the thousands of pathogen samples that may have contained and could have contained unknown and dangerous pathogens. The agency also failed to take meaningful action regarding a refrigerator that was labeled Ebola during their so-called investigation. CDC's response was totally inadequate and failed to provide any support for the local government and put the public at risk through indifference. This is not acceptable, and the CDC must do better. As we look to the future, it's clear that the CDC needs to do more than just a reset. There needs to be a seismic shift. The agency announced in April of 2022 that they were going to undergo a reform by starting to review their processes and structures in place. Since, they have made a handful of changes, but more is needed. I know that you've not been there long enough to implement a seismic shift, but I hope we can start to see CDC guidance driven by the latest science and robust evidence. In closing, I hope your tenure as director will start that process and reinvigorate this important agency. Thank you. And I yield back to myself and now recognize the subcommittee ranking member, Ms. Castor, for her 5-minute opening statement.
Well, thank you, Mr. Chairman, and good morning, everyone. Welcome, Dr. Cohn. Thank you for your service as the newest director of the Centers for Disease Control and Prevention. The timing of your appearance here today is very important, as we want to ensure that all Americans have all necessary information to protect themselves from respiratory disease as we head into the season of higher infections and illness driven by flu, COVID-19, and RSV. This subcommittee held a hearing in July on how CDC can improve its effectiveness in performing its core public health missions, but they did so without having anyone from the CDC who could provide a substantive update. So thankfully, we can hear directly from Dr. Cohn today about her priorities to help Americans stay healthy and to prevent and fight disease. One of the strengths of the CDC is that it works in collaboration with states and local communities. Strong public health partnerships and infrastructure are our best line of defense against disease. Families, communities, businesses, and policymakers like us rely on up-to-date information to understand risks and to devise prevention strategies. Working together, we can improve the lives and health of Americans. Earlier this week, CDC released data showing that life expectancy in America last year increased slightly after a decrease in 2020 and 2021 due to the heavy toll caused by COVID-19, where over 1 million Americans lost their lives. Even with that slight improvement, we are struggling compared to other wealthy countries. Nevertheless, thanks to the historic emergency legislation passed by Democrats in the last Congress and the extraordinary efforts of communities and health professionals across the country and the Biden administration, we've put the dark days of the pandemic behind us. We can focus anew on ongoing public health threats like heart disease, cancer, maternal mortality, opioid addiction, suicides, and gun violence. For a country that is grappling with debts and deficits, and for families looking to lower health care costs, it's more important than ever that we ensure that all Americans have access to good nutrition and life-saving vaccines, and that they don't start smoking cigarettes. Unfortunately, nearly 4 years after the onset of the COVID-19 pandemic, some of my Republican colleagues continue to aggressively undermine cost-saving prevention work and malign scientists performing life-saving medical research. The Republican majority has actively opposed strengthening public health and failed to use the lessons learned to better position America to respond to a future health emergency. Republican budgets in Congress tell the story. Instead of working to keep our neighbors safe and avoid higher health care costs, Republicans want to take us backwards through harmful cutbacks, shutdowns, and budget showdowns. Meanwhile, Democrats are working to put people over politics, to keep our neighbors healthy and well, to prevent unnecessary hospitalizations and deaths, and to be ready for the next Ebola or Zika or coronavirus. You never know what is going to happen. For example, earlier this summer, Sarasota, Florida, just south of me, they experienced a surprising outbreak of malaria with patients hospitalized. Thank goodness CDC experts jumped in to aid the community and develop a containment and prevention strategy. See, there hasn't been a malaria outbreak in the United States in 20 years. And that's good, because malaria is one of the world's greatest public health problems and affects approximately 219 million people each year, with over 600,000 deaths. So we're grateful for the strong response by CDC, but it's also a great example of the importance of timely information for the public. Access to timely health information became entirely too political during COVID, when some officials in my state and in other places concealed and altered information that the public needed. So I hope we can all work together to improve the availability of accurate and timely health information for the public. Even in the best of circumstances, CDC has a very difficult job. While some politicians are intent on discrediting CDC or actively spreading misinformation, as former President Trump did repeatedly in 2020 during the height of the coronavirus pandemic, and as the governor and surgeon general in my state, Florida, continue to do so today, gosh, the job gets so much harder. So we can do better. We can come together to support the public, improve the public health, make sure that all Americans, our neighbors, stay healthy and well. So I look forward to hearing from Dr. Cohn today about CDC's efforts to strengthen prevention efforts and keep Americans healthy and safe. Thank you, and I yield back my time.
Thank the gentlelady. Now recognize the chair of the full committee, Ms. Rogers, for her 5-minute opening statement.
Thank you, Chair. Here we go. Thank you, Chair Griffith. And I'd also like to welcome and congratulate Director Cohen as becoming the director of the Center for Disease Control and Prevention. I believe that we must have a transparent and honest conversation about the future of CDC, an agency that has never and needs to be authorized by Congress. Director Cohen, you might be the last appointed CDC director without a Senate confirmation, and your actions and decisions can help return the CDC back to its fundamental mission, or your actions could allow the CDC to drift further away and worsen public trust. We want to hear from you today about CDC's preparedness for the current wave of seasonal viruses such as flu, RSV, and COVID-19. And at the same time, we want to examine CDC's past decisions and guidance to understand how you're taking lessons learned from COVID-19, Mpox, and other recent public health threats to improve our current and future public health strategies. This is a chance to restore transparency and build public trust in our health institutions and ensure that CDC's issued guidance is clear, practical, and consistently relevant and up to date with the latest science. Sometimes this may include telling the American people what the CDC does and doesn't know. To put this bluntly, your predecessors took bad advice. They acted on bad advice due to political pressure and misled the American people. The institution you now run influenced schools to remain closed by listening to non-scientific stakeholders, namely the teachers' unions. And because of their guidance to keep schools closed for an extended period, our children, the very future of our country, now suffer generational learning loss and devastating mental health conditions. The gravity of the situation is clear. If we fail to restore trust in public health institutions and correct past mistakes, the consequences for our children and our country could be dire. It is in this context of urgency that we must consider the substantial investments made during the pandemic. Congress provided schools with $190 billion to combat COVID, allocating the estimated 20% to mitigate learning loss. And despite these efforts, students in grades 3 through 8 are lagging months, if not years, behind in reading and math abilities. Nationwide, our children's academic performance has suffered a historic decline, with reading and math scores plummeting to the lowest levels in 30 years. Further, school attendance is down and students are dealing with a crisis of loneliness. These facts are not merely statistics. They are our children, our nieces and nephews, our neighbors' children. They're the next generation, and right now, this is a stark indication of the broader fallout from actions taken during the COVID-19 response that we're only beginning to uncover. As we reflect on the events that led us to this point, we must acknowledge the weight of responsibility that comes with being the director of the CDC. The agency's guidance has far-reaching implications affecting not just public health, but our day-to-day lives and the overall well-being of our children. It is imperative that we see a commitment to cooperating with Congress. Too many of our inquiries to your predecessor went inadequately answered or wholly ignored, and I think we all agree that being transparent with us and the Americans that we represent is foundational to restoring trust. I know this is your first time testifying before Congress as director of the CDC, but this hearing is more than a procedural formality. It is a pivotal moment for accountability and reassessment. The insights shared today will not only shed light on past decisions, but will also take a step toward rebuilding trust. This hearing is an opportunity to share how you will apply lessons learned to the current respiratory illness season as well as future decisions by the CDC. Director Cohen, you have an opportunity today to inform the committee and the American people how you plan to lead as director. And we look forward to your testimony and hearing about how you're going to lead the CDC moving forward and restore public trust. Thank you again for being here. Chair Griffith, I yield back.
Thanks, lady, for yielding back, and now recognize Mr. Pallone, ranking member of the full committee, for his 5-minute opening statement.
Thank you, Mr. Chairman, and thank you for being here, Dr. Cohen, and I look forward to your testimony today and to working with you on all the important issues that the Centers for Disease Control and Prevention is tackling. Particularly at this time of year, it's critical that we make every effort to extend access to vaccines against seasonal respiratory illnesses to all Americans. With new options and new methods of vaccine delivery, it takes a coordinated effort between the CDC, local health departments, and those who are on the ground distributing and administering these vaccines. And right now, COVID-19 vaccines are being distributed commercially and not by the government for the first time since the beginning of the pandemic. The RSV vaccine is also now available for the first time for older Americans, and it's critical that we communicate a clear message to Americans about where and how to get vaccinated to protect themselves and their families from respiratory illness. Now, the CDC has produced a comprehensive campaign to inform the American public about the availability of COVID-19, influenza, and RSV vaccines. Providing clear guidance based on the best available science is core to CDC's mission, and it's encouraging to see you personally contributing to this campaign, Dr. Cohen. But Congress has to also do its part. We must ensure that CDC has the resources and authorities needed to best serve the American people and protect our health and well-being. The COVID-19 pandemic exposed systematic shortcomings in our public health infrastructure and preparedness that we must address. But instead of coming together to advance the bipartisan Pandemic and All Hazards Preparedness Act, or PAPA reauthorization, that applies the hard lessons learned from the pandemic, our Republican colleagues push an inadequate and partisan reauthorization through this committee. And I continue to be astonished and disappointed that we still can't agree on the hard lessons learned during the pandemic. The very title of this hearing shows that my Republican colleagues have disdain for masks, which was an important and effective tool in reducing the spread of the deadly virus. It's unfortunate that a rejection of science seems to have taken hold of House Republicans. And this refusal to learn from the past makes it very difficult to find a bipartisan path forward on necessary and important legislation to protect the American people as we go forward. Over and over again, public health experts have told us that having access to timely data during the pandemic was critical to an effective response. Access to updated, streamlined, and coordinated data is essential in order for CDC to provide recommendations, guidance, and public health information to the general public in a way that is useful and timely. And better health information means better guidance for the public. Unfortunately, our Republican colleagues refuse to include such a provision in their extreme and partisan PAPA reauthorization bill. Democrats, on the other hand, are committed to future preparedness and will continue to work towards that goal. We saw what happened during the early days of the pandemic, and we should do whatever we can to avoid relearning those horrible lessons. And I certainly hope we can have a productive discussion today with Dr. Cohen about her vision and priorities for CDC. We understandably spent a lot of time talking about COVID, but there are countless other health issues that CDC is always addressing domestically and globally, such as maternal mortality and morbidity, the opioid epidemic, mental health, rates of sexually transmitted infections, and shortages in our healthcare workforce. And all of this work depends on good data and a sound public health infrastructure that enables effective communication between CDC and local governments across the country. We have to be able to spot threats early and evaluate the effectiveness of interventions so that Americans can receive the guidance and the assistance they deserve. But Congress also needs to ensure that CDC has adequate resources to do its work. You only need to look at the House Republicans' extreme appropriations bill to see that they are not serious about strengthening our public health system. House Republicans want to cut $1.6 billion from CDC's current funding level. This drastic funding cut would seriously undermine CDC's ability to perform its vital mission and would endanger public health and safety. So it once again shows how House Republicans continue to cave to the extreme elements in their party who have no interest in governing, in my opinion. So it's time for Congress to be a partner, not an impediment, to making important and necessary reforms that make our nation safer. So I thank you, Dr. Cohen, and I'm pleased, Mr. Chairman, that we're having this important hearing today. Thank you again. I yield back.
Thank the gentleman for yielding back. This concludes members' opening statements. Members are reminded that pursuant to committee rules, all members' written opening statements will be made part of the record, but be sure to provide those opening statements for the record to the clerk promptly. We want to thank our witness for being here today and taking time to testify before the subcommittee. You will have the opportunity to give an opening statement followed by a round of questions from members. Our witness today is Dr. Mandy Cohen, Director of the Centers for Disease Control and Prevention. We appreciate you taking your time to be here today and look forward to hearing from you. As you know, if you testify in front of this committee, we generally, I guess always, I can't recall a time we didn't, we take our evidence under oath. Do you have an objection to testifying under oath today? Seeing that the gentlelady has not objected, we will proceed. The chair also advises you you are entitled to be advised by counsel pursuant to House rules. Do you desire to be advised by counsel during your testimony today?
No, sir.
All right. Seeing that she has not requested to have counsel present, would you please rise and raise your right hand? Do you promise to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Seeing the witness answering in the affirmative, you may